Hello everyone, myself Dr. Savita Jarad. Now we are seeing about the signs or diagnosis of pregnancy. In that, what are the signs and symptoms? So there are three types of the signs. That is the presumptive signs, probable signs, and the positive signs, which are going to be present. So for this diagnosis of pregnancy, we have to divide this pregnancy, that is total 40 weeks, into three trimesters. That is first trimester, second trimester, and the third trimester. So what is it? If you see in this is the first trimester. From where it is? From 0 to 12 weeks. Then second trimester, it is from 13 to 28 weeks. And third trimester, it is from the 29 to 40 weeks. And in this three trimester, there are different types of the symptoms are going to be present. So these are presumptive signs, probable signs, and positive signs. So whatever this three trimester, there is another one second synonym for this that we have to see it. That is first trimester is also called as a early trimester. Then the second trimester it is called as a mid trimester, and the last one, that is the third trimester, is also called as a late trimester. So that is in short, that is how we are going to divide this. We are going to divide the trimester in a different way. That is first trimester, second trimester, and the third trimester. So that is first trimester, first 12 weeks, 13 to 28, and 29 to 40, early, mid, and late trimester. So now diagnosis in the first trimester. So how we are going to do there are some symptoms and the signs also. So which are the symptoms? So symptoms can be a cessation of menstruation, that is missed period, or first symptom, that is what we have to, that is amenorrhea. So why it is? Because due to increased estrogen and progesterone production at the corpus luteum, that is pregnancy during lactation amenorrhea, that is called as a, that is the slight bleeding at the expected time of menstruation rarely occurs in the first 3 months. That is called as a Hartmann sign or placental sign. That is, it is. But what is the difference? In normal menstrual period, the bleeding is about up to 80 ml, while in case in Hartmann sign and placental sign, whatever the bleeding, it is scanty. That is how can you differentiate. And should not get confused with that of a threatened abortion, because what most of the time what we think about it, it is a abortion or threatened abortion. But what is it? It is a placental sign. And how much the discharge? It is the scanty discharge what we are going to observe. So next symptom, that is first what we are seeing the amenorrhea. Second symptom, it is the most important, morning sickness. And how is the percentage wise? It is about some 50% cases that what we observe is. So it is usually appears soon following the missed period. Then there is a nausea, vomiting, especially in the morning or on rising from the bed. And what is basic is it usually disappears after the third month. So there is a one terminology that is called as a hyperemesis gravidarum. But what is the difference between morning sickness and hyperemesis? Hyper, that is excessive, that it has a deleterious effect on the health of the mother. But in morning sickness, what is it? It is not that much excessive. What is it? It disappears after the third month. And in hyperemesis gravidarum, it continues even after that. So frequency of maturation. So next one is that is frequency of maturation due to condition of bladder mucosa, irritation of the bladder by the pregnant uterus. That is resting of bulk uterus on the bladder and evacuation of the uterus. The change in the maternal osmoregulation leads to the increased thirst and the polyuria. That may be very good and usually disappears after the third month. That is frequency of maturation. And there are some breast symptoms which are going to be, that is enlargement, that is heaviness and discomfort and pricking sensation. And when it occurs, so this occurs from the 6 to the 8 week, especially in the primary gravidas. And next one is that is the appetite changes. These are the symptoms. There are signs also, those signs. That is what we are going to say in the sign section. That is non-purgatory reversal. And then next one is there is the appetite change. So there is something craving for the certain types of food and refusal of other types. So that is called as a pica. Pica, that is craving for the certain types of the food. And the fatigue, that is a frequent symptoms that may occur in pregnancy, and what it leads to, the female most of the times want to sleep, so that is tendency to sleep, that may be the reason for that is the symptoms we going to be seen. And what are the objective signs, objective which are observed, so in that breast signs, that what I already said, that there are symptoms also related to the breast, and there are signs also. So which one is that in that breast signs that is evident in a primary gravida when it occurs, that is it is 6 to 8 weeks. And what is it? That is the increased size and vascularity. That is what we have seen in the symptoms. Seen this symptoms: enlargement, heaviness, discomfort, and pricking sensation. But there are some signs also. So what is it? There is a some dilated visible veins, increased pigmentation of the nipple and the areola, then the appearance of secondary, that is primary areola, and appearance of the secondary areola. The appearance of the Montevideo tubercles in the areola, that is some dilated sebaceous gland, and expression of colostrum, that is what is called as a thick yellow color secretion. That is when it occurs, it is as early as 12th week. And see, this is the changes, that is, see, this is the non-pregnant, this is early pregnancy, and this is changes, it is become dark, that is in the late pregnancy. And now we are going to say about the non-purgatory tubercles. So what is it? This is the nipple, and whatever is tubercles which are present around it, that is the non-purgatory tubercle in the areola. So this is the sign. This is what is it? Actually, it is dilated sebaceous glands. That is what we are going to observe this. Then there are some changes in the abdomen. So what are the changes? So uterus remains a pelvic organ during the first trimester. That is up to the 10th week. So it may be just felt per abdomen, suprapubic bulge, nothing more. And the pelvic changes, that is some changes, that is the Jacquemus or Chadwick sign, Osiander sign, Goodell sign. So what is Jacquemus sign? Also known as a Chadwick sign. So what is it? It is the dusky hue of the vestibule and the anterior vaginal wall, which is visible at the 8th week. That is one. So next one is, it is more pronounced as pregnancy advances, and it's more definitely present in multipara. And there is some due to local vascular congestion. Why this is occurring? So what is the when the Chadwick sign? So definitely it, or when the question when there is a Jacquemus sign. So definitely first it is a sign of the pregnancy of first trimester. Second synonym for it is Chadwick sign. What happens? It gives the color changes, that is dusky hue color of what vestibule and anterior vaginal wall. Then it is observed, or when it is able to, we are able to visible, it is at the 8th week, and it is more pronounced as pregnancy advances, or where it is more visible in the multipara. Why this is occurring? So due to some local vascular congestion. So that is called as a Jacquemus sign. Then Osiander signs. So what is it? It is again, if Osiander sign, it is a sign of the pregnancy during the first trimester. First trimester, that is the second synonym, it is early trimester, that is from first to 12 weeks. What is it? It is a pulsation, it is increased pulsation, and when felt through the lateral corners, when it is felt at the 8th week, that is Osiander sign. Then Goodell sign. So Goodell sign, again, it is a sign of first trimester. It is a sign of pelvic sign where there is a cervix becomes soft as early as the sixth week, and the softening is more surrounding the external os and also in the upper part. The pregnant cervix feels like that of lip of the mouth. So, and if you see, non-pregnant cervix feels like the tip of the nose. If you touch your nose, how it is some little bit of some hard as compared to that of lips. While in pregnancy, the cervix feels like that of the soft as like that of the lip of the mouth. So that is called as a Goodell's sign. And on speculum examination, there is a bluish discoloration of the cervix is visible due to the increased vascularity. So that is blood supply is increased. So that may be the observation that what we say. So that is called as a Goodell's sign. So there are some signs that is uterine sign that is felt by the bimanual examination, and that is these are uterine signs. So what is it? That is the Hagar sign and the Palmer sign. So how when it is observed, it is by bimanual examination. What happened? That the size is enlarged. Then second point, what we see, whatever the normal size and shape of the uterus, there is a change. So what is the how is the size? What is the consistency? How is the shape of it? On that basis, the Hagar sign and the Palmer sign. So what is it? The size it is enlarged. Then consistency, how of the consistency of the uterus? It is the soft, and the shape it becomes the globular line. So what is it is the Hagar sign? So Hagar sign again, it is a sign of the pregnancy in the first trimester. It is a uterine sign. And what is it is elected when it is elected? It is between the 6 to 10 weeks. How it is by manual examination. What happens? What we do it over here? We whatever the two fingers in the we introduce the finger, that is two fingers in the anterior fornix, and the fingers of the other hand over the abdomen behind the uterus. And the fingers of both the hands can be approximated as the lower part of the uterine body is soft and empty. So that is called as a Hagar sign. So lower part it becomes soft and empty, while upper part it is enlarged because this is in the initial stage. And what is Palmer sign? So what is it? It is a uterine contraction felt on bimanual examination. So if you do the bimanual examination, so what you feel? The uterine contraction, that is Palmer sign. So remember, in uterine sign, there are two, Hagar and Palmer, while that of previously pelvic changes, that is Jacular, Ossiander, and Goodell sign. So in between, what we have to do the UPT test. That is for that. What is important? HCG. What is HCG? That is human chorionic gonadotropin. What is it? This is a hormone. What is it? Is only released by tropoplastic tissue produced by a growing fetus and its associated placenta. Basically, this HCG it is released by tropoplastic tissue of what? Of placenta, chorion, which is present. And when chorion is present, but obvious that is the implantation has taken place. And that indicates the pregnancy is there. If implantation is not there, so how can you say that there is a pregnancy? So for that, this is released by the chorion, that is tropoplastic tissue produced by a growing fetus and its associated placenta. So HCG is present in the maternal circulation as either at intact dimer alpha or beta subunit and degraded form or beta core fragment. So whatever this detection of HCG in the maternal serum and urine is evident only 8 to 10 days after conception. So you can't say that means when the conception has taken place, after that 8 to 10 days, you have to do the UPT test. That is, if any female is having date of some second of July, so you can't. Then if third August if the pregnancy menses does not occur, so on then 4th August you can't say that immediately the whatever the UPT is going to be positive. So it requires some time. So we know that after some fertilization has taken place, it requires near about some 8 to 10 days after conception, and then the this HCG, which is going to be present in the urine, and then it is going to be positive. So HCG is detectable in the serum of approximately 5% of patients days after conception, and in more than 98% of patients by day 11. So that is after conception, it requires near about some 11 days. So diagnostics levels in urine seen only after 23 to 24 days after the conception. So definitely it requires about clear diagnosis, it requires 23 to 24 days. Level peak at 10 to 12 weeks gestation, and then plateau before following. So that is the HCG. So how it is? So this is post-ovulation. That is, the ovulation has taken place on 14 days. And then how the HCG level it is increasing. Then 15, then 16, then 17, then 18, 19, 20, 24. How it is increasing. So this is the HCG level of, and then you can say it is. So it is general, the HCG level will double every 2 to 3 days in early pregnancy. So it is doubling after 2 to 3 days. Here, then here. So this upward direction. Then blood test for HCG used only in special cases. So that is what we have to do in HCG. So that is if there is a bad obstetric history, that is suspicion of ectopic pregnancy, then you have to think about the blood test. That is required special labs and expertise. That is currently 4 HCG assays are used. That is radio immunoassay, radiometric assay, then the enzyme-linked immunosorbent assay, that is ELISA, and the fluoroimmunoassay, that is in exceptional cases or special cases that you have to use this blood test for HCG. So that is radio immunoassay, that is what you see, that sensitivity, time to complete, then post-conception age when the first positive, and gestational age when the first positive. The sensitivity, it is 5 mIU per ml, then time to complete it is 4 hours, and post-conception age when first positive, that is 10 to 18 days, it requires time. And the gestational age when first positive, that is about 3 to 4 weeks. And immunoradiometric assay, that is more sensitive. So sensitivity is, it is about 150 mIU per ml. Time to complete 30 minutes it requires. So it is, upside it is time 4 hours it requires. So it requires only 30 minutes. Then post-conception age, when the first positive, it is 18 to 22 days, and gestational age when first positive, that is 4 weeks. Then immunoradiometric assay, that is very less sensitive. Sensitivity, it is 1,500 mIU per ml. And time to complete, it is 2 minutes. It is post-conception age when first positive, it is 25 to 28 days. And gestational age when first positive, it is 5 weeks. So it is an enzyme-linked immunosorbent assay that is more sensitive, that is more sensitivity, it is 25 mIU per ml, and the time it is required, it is 80 minutes. So near about some 1 hour and 20, just more than 1 hour. It is post-conception age when first positive is 14 to 17 days, and gestational age when first positive is 2.5 weeks. The minimum time required, it is time to complete, it is immunosorbent. Immunoradium assay, that is, it is requires only 2 minutes for this scope. Then enzyme-linked immunosorbent assay, that is it is less sensitive. Sensitivity, it is about some less than 50 ml per ml. Time to complete, it is 5 to 15 minutes. And post-conception age, when the first positive, it is 18 to 22 days. Gestational age, when first positive, it is 4 weeks. And fluoroimmunoassay, that is sensitivity 1 mIU per ml. Time to complete, it is 2 to 3 hours. And post-conception age, when first positive, it is 40 to 17 days. Gestational age, when first positive, it is 3.5 weeks. And simple, what is ultrasound, that what we can do. It is the intradecidual gestational sac, which is identified as early as, that is what you see in this diagram. So this is the small little bit of sac that what we are observing. Yes. So this is about as early that we can find out in 29 to 35 days of gestation. And gestational sac and milk sac that is 5 months in this. Then fetal phone and cardiac activity 6 weeks, embryonic movement 7 weeks, and the Doppler effect of ultrasonography can pick heart rate reliably by 10th week. So by 10th week we can find out the heart rate. It means can pick heart rate reliably. So that is how can we do the ultrasound. So that is what we have seen the diagnosis of the first trimester. Now we are going to see about the diagnosis in the second trimester. In second trimester, it is about 13 to 20 weeks. That is second word. It is mid trimester. Then symptoms and the signs. So what are the basic symptoms? That is amenorrhea, then morning sickness and urinary symptoms gradually decrease. So first everywhere, whether it is first trimester, second trimester, or third trimester. Basic first important symptom is going to be amenorrhea. Then other symptoms. Then morning sickness, which is present in the first trimester, it is going to subside. So it is gradually decrease. Then some quickening, that is, what is quickening? It is the perception of fetal movement by the pregnant woman. Then when it is felt by the mother. So it is in depending upon the primary gravity and the multi. So this first time a female is pregnant, that is in primary, that is it is about primary gravida, it is spent it is 18 to 20 weeks. While in multi-para, so it is spent by the 16 to 18 weeks. And there is abdominal enlargement also. So that is abdominal, if you do the abdominal examination, what we see that in inspection. Say in this, so this is the black line which is we are going to observe it. So that is the linea nigra. Linea means line, nigra means black. And as this is the line black, so it is the linea nigra. From there it is from the pubic, this one, downward from the pubic symphysis to upside it is the ensiform cartilage. That is, and when it is felt, it is seen since 20th week. And some what we are saying is white here, and this is called as a stria. So what is it? It is the color wise, it is pinkish or whitish color, and visible in where it is mostly in the lower abdomen, more towards the flanks. So that is called as a stria grave. Stria means little bit of strips. That's what we are saying. Now what we have to see the fundal height. So this is fundal height. That is what we have to fundal height increase with the progression of enlargement of the uterus. So see, this is you can say that pubic symphysis, then umbilical, and then so it is up to the pubic symphysis. This line is up to the pubic symphysis. It is 12, then 22. Sometimes it is 22. Sometimes it is 24. And upside it is 36. So important 12, 24, 36. Over it is 22. But some it is 24. And in between, then add 4, 16, then 20, then 24, then 28, then 32, then 36, then 36, 36, then 40. But what happened over here? 38, it is up one, and but 40, it does not go more, but it goes downward direction. It decreases. In 40, it decreases. The fundal height is measured in centimeters from the pubic symphysis to the topmost portion of the uterus. So that is how we are going to measure the fundal height. That is on the palpation. So the uterus is abdominally filled, oval. The uterus feels soft and elastic. Then there is some Braxton fixed contraction. So what is it? It is an intermittent painless contraction which is detected by the abdominal examination. So when you do the abdominal examination, this is felt by the physician, not by the patient. and it is active fetal movement can be felt at intervals that lessen the hand over the uterus as early as 28 weeks. And next one, it is the external ballotment that is elected at 28th week through the abdominal examination and palpation of the fetal parts and palpation of fetal movements by the obstetrician at 20th weeks. And on auscultation of FHS as early as 20 to 24 weeks by Pinard stethoscope. So auscultation of funic or fetal shuffle due to rush of blood through the umbilical artery. So that's what we are seeing it. And auscultation of uterine shuffle, soft blowing and some systolic murmur heard. Low on at the sides of the uterus that is synchronous with the maternal pulse. That is what we have observed. Sometimes in second trimester, we observe some changes in the skin also. So in general examination, we see that some pigmentation over the forehead and cheek that is called as a floasma. See, this is some blackish discoloration which is seen on the face, or some breast changes that is enlargement with prominent veins, secondary oral and montoviral tubercles are prominent and extended. Colostrum. So this is non-lactating, this is engorged. So so abdominal examination can be inspection, palpation, auscultation, that is uterine shuffle, that what we have seen it. So we are going to do it. So it is soft blowing systolic murmur, heard blow down at the sides of the uterus, best on the left side. So it is funic or fetal shuffle is due to rush of blood through the umbilical arteries. That is what we are seeing over here. So this is how the hand is kept over the abdomen. Say that this is inside of the fetus, which is the head. This is the back part of it. And the vaginal examination, that is the blue discoloration and internal alignment. That is the hand, it is introduced inside of the vagina. And one hand, it is kept on upper side. This is what is uterus. And basic investigations, that is sonography, that is fetal organ anatomy, magnetic resonance imaging, see it. So next comes is the what we are going to say about the last trimester. In last diagnosis in the third trimester, that is late trimester, that is 29 to 40 weeks. So what are the symptoms? That is amenorrhea going to be first, then enlargement of the abdomen that is leading to discomfort to the patient, or palpitation or dyspnea following the exertion that is going to be there, or something lightning that is 38 weeks, week to sensation of the release of the pressure symptoms due to engagement of the presenting part. That is called as a lightning. Lightning means not listen, but release. What we see in this diagram. See, in 38 weeks, it is this one diaphragm over here. 38 weeks, the height of the uterus it is over here. But in 40 weeks, it goes downward. So definitely, female feels comfort. That is called as a lightning because it leaves some little bit of comfort feeling to the mother. But because the engagement has taken place. So that's why female feeling comfortable. That is called as a lightning. When it is still 38 weeks. And what is the reason behind? Because the pressure which has becomes the less. And why? Due to engagement from the presenting part. So frequency of maturation reappears again over here, and the fetal movements are more pronounced. So signs some cutaneous changes are become more prominent with the increased pigmentation and stria. So the uterine shape that is from cylindrical to spherical beyond the 36 week. Now shape has changed. From cylindrical to it becomes a more of a spherical one. And the fundal height, that is the distance between the umbilical and the ensiform cartilage, So it is a junction of the upper and the middle third at the 32 weeks. Then level of instron cartilage at 36 weeks, and it comes down to 32 level. See, it comes down at the 48 weeks. Reason behind it, because of the engagement of the placenta. Then symphysis fundal height, that is upper border of the fundus located by ulnar border of the left hand, and point is marked. It is distance between the upper border of the symphysis is up to the point mark is measured in centimeter. And after 24 weeks, the SFH, that is symphysis fundal height, in centimeter corresponds to the number of weeks up to the 36 weeks. And Braxton Hicks contraction, it becomes more evident and fetal movement easily felt. Then on the palpation of the fetal parts and their identification become much easier now. So on the, if you do the palpation, you can find this is the back region, that is this is the this one spinal column, means back part of it. This is the parts fingers, that is limbs, what we can easily feel it, identify it. And FHS, that is fetal heart sound, which is heard distinctly. And on sonography, that is fetal growth assessment can be made more accurately. And amniotic fluid volume assessment for oligo, that is what we have seen in the previous, that is if the amniotic fluid it is more or less. If it is less, then it is called as oligohydramnios. If it is more, then it is called as polyhydramnios. So there are some differential diagnosis we have to again remember. So it may be uterine fibroid, but it can be presented with amenorrhea. That is how can we clinically get over here. Then cystic ovarian tumor, that is amenorrhea absent form, and hard positive sign absent, that is an ultrasonography. That is cystic ovarian tumor. Then insistent tubercular peritonitis, that is if there is a insistent tubercular peritonitis, so definitely there has to be some history of pox infection. And swelling, it is ill-defined, you can't find out. And the positive sign absent, whatever the signs which we have seen here. So whatever the signs, that is the Hagar signs, Palmer signs, whatever trimester signs what we have seen in above also, in 62 variant tumor and in over also, whatever the positive signs of the pregnancy are absent. Ultrasonography will be helpful. Then hematometra and distended urinary bladder, even catheterization solves the problem. So this becomes decreasing the abdominal and the pseudocyesis, that is some psychological thinking. That is also a situation that what we can rule out the patient. So that is how we can see. So now let's have the revision of what we have seen today. So what we have seen about the diagnosis of pregnancy. So there are basically menstruation is also known as the menstrual age, also known gestational age from the first day of the last menstrual period. So total it is about pregnancy, it is of 9 months, 7 days. In days wise it is 280 days, and in the weeks wise it is 40 weeks. And for understanding, we have divided into the trimester. How many trimester? 3 trimester. Which one? First, second, third. First, that is a second synonym for age, that is early, mid, and late trimester. Up to first to 12, 13 to 28, and 29 to 40 weeks. That is trimester. Then symptoms everywhere, absence of menses is going to be there. Then some slight bleeding is there, that is called as a Hartmann sign or placental sign. So don't confuse with fetal abortion over here. There is a vomiting, that is called as a morning sickness, but it subsides after third month. And if it is hyperemesis gravidarum, it does not subside about the third month. And it is the 50% cases that is morning sickness is present. Then frequency of micturition due to the problem in the osmoregulation in the mother, which leads to the increase in the thrust and polyuria. The frequency of micturition. This again subsides after third month and again reappears in the late trimester. But the patient. Then breast symptoms. That is the symptom. Breast is having symptoms and signs also. That is enlargement, heaviness, that is discomfort, pricking sensation at 6 to 8 weeks. Then appetite changes, craving for certain specific food, that is called as a pica. Then exhaustion, feeling sleepy, that is fatigue. Then objective signs, that is breast sign, Montevideo tubercle, this is changes. This one is non-pregnant, early pregnancy, late pregnancy. And this is Montevideo tubercle. That is nothing but genital sebaceous glands. Then on abdomen, again we have divided into two parts, pelvic changes and the uterine changes. And the signs again, pelvic, that is Jacqueline or Chadwick signs, Osiander signs, and Goodell signs. In Jacqueline, that is called as the Chadwick signs, that is just color. That is Jacqueline or Chadwick sign. Second, Osiander, it is pulsation. The sender sign, it is pulsation, and Goodell's, that is softness of the cervix like lip. That is what you have to remember. That is softness of cervix like lip. Goodell's. And uterus, the two signs are there, Hagar and Palmer sign. Okay, that's Hagar. That is related with the some one hand it is push, and the lower part of the uterus it is soft and tempting. That is what you observe it. And in Palmer sign, that is uterine contraction are felt. That is binomial. Then some test, that is HCG. HCG stands for human coronary gonadotrophy. Slow, it is increases slowly after 24 months. Then sometimes in special cases we have to do the HCG, that is in suspicion of ectopic pregnancy in an emergency situation, or in some bad obstetric history that they require, which are radioimmunoassay, immunoradiometric assay, and ELISA and fluoroimmunoassay. In that, very less time required by the, it is the immunoradium assay, but it is less sensitive. Then basically ultrasound that was very in this diagram. This is just a close fact which is identified. It is identified as early as 20 of gestation. Again, there is a Doppler effect of scan. Also, which can pick the heart rate reliably by 30 centimeters. Then in second trimester, that is in 13 to 28 weeks, same symptoms, basic amenorrhea. Everywhere it is the symptom amenorrhea, whether it is first, second, third. First basic symptom amenorrhea. Then monocycles, thickening, and abdominal enlargement. Thickening, which is perception of fetal moment, which is fed by the pregnancy. It varies from primary and multi. In primary gravidae, it is 18 to 20 weeks, and in multifera, 16 to 20 weeks. So this is one black line, that is linear nigra. These are the same pinkish whitish, that is gravidae. Then changes in the fundal height, 10, 22 to 24, 36. And in 14, it goes downward because of engagement of the pregnancy. So these are the changes which takes place in the uterus. Then auscultation, what we feel, that is the feeling of fetal suffering. Then investigation sonography, fetal organ anatomy, fetal viability, and radiology. 16 weeks, that is fetal skeletal shape. And in third trimester, basic symptoms, that is from 29 to 30 weeks, symptom basic amenorrhea, it is going to be there in all three trimesters. Then enlargement of the abdomen, then lightening after 38 weeks, some relief to the pressure symptoms due to engagement of the pregnancy. That is called as a lightening. Yes, unsaid frequency of miscarriage reappears, fetal movements are become more pronounced, and the cutaneous changes, that is the fundal height increases, uterine shape becomes from cylindrical to spherical. Then suppresses fundal height, that what we have to measure it. The baxter hips contraction becomes more evident, fetal movement is visible, and you can able to feel the FHS properly. Sonography, that's what we have to do it. The fetal growth assessment, we can do it and see amniotic fluid assessment, that's what we are saying in previous lecture. That is to assess whether there is oligohydramnios and polyhydramnios. There is one situation that we can, that is, some may it is asked what are the cutaneous changes during the pregnancy. Plasma, then monofilament tubercles, and the linear nigrum striatum. That is the cutaneous pneumonia. That is the changes which takes place in the skin. That is called as the cutaneous changes in the pregnancy. That what we have seen there. And lastly, that what we have seen, what is the differential diagnosis? So it may be uterine fibroid, it may be cystic ovarian tumor, it may be incystic tubercular peritonitis, and hematoma, and distended urinary bladder mandate in case of cystic ovarian tumor and incystic tubercular peritonitis. Definitely there is a absence of the positive signs that what we have seen up till now. These signs are going to be but obviously absent. And in incystic tubercular peritonitis, there has to be history of cough. Then and then will approach to the incystic tubercular peritonitis, and there is history of cough infection is going to be there. So, and ultrasonography that obviously going to help you to rule out this differential diagnosis. So that is what in short what we have seen today, the diagnosis of pregnancy, that is symptoms and signs in trimestral months. Thank you very much.